Thank you so much. Good morning to you all. I'm Sulekha Shrestha, and I have been working as a nurse for last 18 years and currently working as a nursing supervisor in Dhulikhel Hospital in Nepal. So Nepal is a landlocked country in Southeast Asia, and it has estimated population of 26.4 million, and it borders China in the north and India in the south, east, and west. So Nepal, it is a multi-ethnic nation with Nepali as an official language, and Dhulikhel Hospital is situated 30 kilometers east from the Kathmandu. So you can see in the image. So under the leadership of Dr. Ram and Dr. Koju, the hospital was established in 1996. So Dr. Ram, at the left side, he's originally from Dhulikhel, and he went to Austria to study medicine, and he did his specialization in general surgery there, and he married with an Austrian girl. Then he had a dream that he wants to come back to his homeland and build a hospital to support the Nepalese people. So it was supported by Dhulikhel community and the well-wishers from different countries in Europe, and made this his dream come true. So this is the location where this hospital was built. So the land was donated from the Dhulikhel community, and there was nothing but just the land. And then the hospital was started, and the road were expanded after the hospital was built. Then in the year of 1996, everything started from the big day when the Dhulikhel Hospital was inaugurated by late King Birendra Vikram Shahadev and his family. So this is the picture of Dhulikhel Hospital, which became the university hospital since 2004 under the Kathmandu University. And this is Dhulikhel Hospital is an independent, not-for-profit, non-government institute, and it is based on the principle of social equity and quality healthcare. So it has now it was started with the 50 beds for the inpatients, and now it has got 375 beds. And it provides health services to approximately 1.9 million population of Nepal, and it covers the many districts. And it is a university hospital that runs the different programs like medical, nursing, physiotherapy program under the collaboration of Kathmandu University. And the main motto of this hospital is to provide quality care to the poor people. So a devastating earthquake hit Nepal in 25th April 2015, and again the second time on 12th May 2015. So these earthquakes have affected more than 8 million people, and it killed about 9,000 people, and more than 40,000 households were affected by this earthquake. So soon after the first earthquake, the patients started to come to hospital for the treatment. All the beds in emergency department were occupied. Finally, the patients were treated on the ground on the mattresses. All the possible spaces were used for the earthquake victims. And hospital, it commenced the free medical services immediately after the earthquake, and the varieties of injuries, trauma, wound, and fractures have been treated immediately. So in our country, we do not have the health insurance system for the people, so they have to pay when they are sick from their pockets. So people, they did not have money to pay during this disaster, so free medical treatment was an essential part at that period of time. So the means of transporting people, patients, were not as usual. The victims were carried on different means of whichever was available at that moment, such as the trucks, mini trucks, vans, or buses. Even the helicopters were used to transport the victims, and there were many people volunteering to transport the patients and saving their lives. And similarly, different local resources were also used to transport patients to the healthcare center. You can see in the picture, the locally made wooden things were used to transport the patients. And there were many volunteers working together to help us, and among them, the Nepal Army and police were the great help for us. They helped us in transporting patients to the treatment area, for taking them to the investigation area, to the operation theater, or bringing blood from the blood bank, and so many things they were volunteering, and it was very helpful. So this was the first day on 25th of April. It was on Saturday. So most of the staff, they were on holiday. And as soon as we knew about this condition of the hospital, we rushed to there, leaving our families at the safe place in the local community under the tents. So we rushed to the hospital, and when we were there, we could see the crowd of victims lying on the emergency beds, or even in the corridors, or even on the hospital grounds. So first few days, there was a chaotic situation because we did not have the disaster plans ready at that time. And so after a few days, our doctors, the hospital core team, they made a plan, and then the group leaders were selected to organize the system for the patient care. And the team of doctors, nurses, paramedics, and students were mobilized in the better way. And the victims were triaged at the entrance of the gate, and different color-coded ribbons were given to code the patient for the different zones. So these are the different colors of ribbons that are given to segregate the patient for the color codes. And the children were the most vulnerable group, and they were always prioritized first for the treatment. You can see the pictures of many children, and they had they were suffered a lot. And the treatment of the patient was started as soon as possible, without any delay, without any money. It was provided. And whereas in other hospitals in Kathmandu, we heard that because the patient could not pay, so they had to close the hospital. And even the hospital gardens were used for the green zone patient for the treatment. And in the operating room, all 5 theaters were run only for the trauma cases, and they were working 20 hours a day for more than 2 weeks. And the OR staffs, they were working day and night without any complaints, despite of suffering damage to their own homes and losses and injuries amongst their family, because saving the lives of the people was the only goal at that moment. And you can see in this picture, the staff were having a rest in the OR for a few hours. And in OR, for the open fractures of tibia, fibula, and other unstable pelvic fracture, external fixator was applied to stabilize the fracture as a damage control and for the wound management. And these are the external fixators that was applied to the patient for the wound management. And for the lower extremity fractures and for the kids, the priority was higher after the open fracture. And these closed femur fractures and hemodynamically stable pelvic fractures needing definite surgery were stabilized with skeletal fractions. And for the upper extremities and closed fractures, they were splinted with the plaster cast, and they were discharged for the definitive management for the later dates, because these fractures could wait for a few weeks or days. And similarly, there were many debridement, flap surgeries, and skin graftings were done, performed for the better management of the open wound. And there were also many vertebral fracture cases. So these were operated during the 3rd and 4th week of the earthquake. And the team from different countries, they helped us for performing these surgeries. And there was another second earthquake on May 12th, while everyone was working in the theater, and you can see the screws, falling over the floor. This was just after the aftershock on 12th May. So looking at the data, here we can see the number of cases operated where total number was 549. So this was the cases were operated from the first day till 7th week of the earthquake, after the earthquake. And in this picture, you can see the most of the operated cases were from the elderly age group. Sorry, adult age group, 16 to 60 years of age. And among the operated cases, the tibia fracture was the most common, highest in number. It was 136. And after the treatment of the patients were discharged from the hospital, but they could not go back to their home because many of them, they have lost their houses, and some houses are completely destroyed, and some are not good for a living condition anymore. So, and some patient had the open wound, and they needed dressing every day. So there were so many people, they could not go back to home. So at that time we had this mobile field hospital down towards the hospital. So the patient were living here for months, and they were having dressings, and they were living here for months until they have their new shelter to live in. And for the inpatient, for the admission of the patient in the hospital, we had this white building. This building was actually built for an outpatient building for the hospital, and it was just finished but completed but not started yet. So that was the best place to keep all the patients there. So, and then we needed beds to manage the patients. So we have many hostels, and the beds were coming from the hostel because the students, they all were had holidays because of the disaster. They were sent home, and these beds were brought from the school hostels to this white building, and here we could manage the patient, and we could admit and treat the patient over there. And the nurses and the student nurses and the teachers, they all were working there, and they were because there were increased number of patients, so we need a lot of manpower. So these students and the teachers and the nurses, they worked a lot to clean the patients, because these patients are usually they are taken out from the mud, and they were very dirty, and they had many injuries. So nursing care was very important at the time. And also because of the threat of infection control, also we had many measures. Even the simple hand washing was, we need to teach even the simple hand washing, and this sanitizers and all those. And we built a separate toilets and safe drinking water. So these are all very important things that we managed at the time. And physiotherapy was also very important. It plays a significant role in rehabilitation of the orthopedic patients after trauma. So we had a team of physiotherapy, and the students also, they help a lot for the rehabilitation of the trauma patients. Similarly, the trauma management of the victim was not enough. They needed a good nutrition to meet their physiological needs, and also the wound healing. So at that moment, our Dhulikhel community, they provided 3 meals in a day to the victims, and even to their family members, free of cost for 2 months. So this was possible only with the great help and helping hands from the local community people and the student volunteers from the schools and the university at hospital. And the hospital staff themselves were involved in the hygienic team. They were helping to clean the hospital and to prevent the infections, and the hospital surroundings. And even the doctors, they were helping us to clean the environment. And Dhulikhel Hospital, it is running 18 outreach centers in different districts of Nepal. And our Dhulikhel Hospital community medicine team, along with the volunteers, from different organizations. They visited many places of our outreach areas by the helicopter or by walking. They served the victims at their doorsteps. And there they provided the first aid treatment, pain management, wound care, and variety of other treatments, and they served the needy people there. Similarly, the relief material to those victims were also distributed. So the relief packages were given to each and every patient who are discharged from the hospital. And these are the materials that you can see in the pictures. So these are the materials that were given especially for the basic needs of the patient, because patient, they do not have home and they need a few days to get established there. And so these things, materials, these items could help them. So with the efficient management of these items, the treatment of our victims was possible in the hospital. And you can see the smiling face of girl after receiving these items. So we had to manage all of these different things that, and so it made us easier or efficient management of the disaster management in our hospital. So these are the things that supplies, there's human resources, access, space, all those things were very important, and we managed it very well. And this is a picture of our Vice Chancellor, Dr. Ram. He's also the founder of our hospital. So under the dynamic leadership of him, it was possible. And he quoted that this is a war without enemy, which caused widespread loss of our lives and destruction. And now it is a time to rally around and bounce back. We need to take charge and change where and when we can. So we feel proud and happy to save these lives and bring smiles of the innocent faces. So after this experience of this earthquake, now we have learned that we must have a disaster plan. So we have now already prepared it, disaster plan, and about the disaster response team and who will be responsible, what are their responsibilities and all those things. So we have now already prepared. And now we have also the warehouse for the storage of these emergency supplies. And now our team is also providing extensive training on different topics to our hospital staff, as well as the paramedics and other staff from the outreach centers. So we'd like to thank all the national and international friends and supporters who have helped us in this difficult time. And we have been able to provide efficient medical care and relief aid to the earthquake survivors, and we will continue to do that. And this valuable support was, it made a lot of differences, because we were running out of the supplies, and there were many countries who were providing us the especially from GRVD, the German Rotary Volunteer Doctors. They brought a lot of implants and screws and plates and the staples with them to help us, to help our orthopedic surgeons, and they were coming here and working with us. Similarly, there were other supplies, medications bringing from different countries, many different countries, and without this support, our mission would not have been possible. So we'd like to thank all and everyone. Thank you so much. This was the end of my presentation. Thank you.
Thank you, Suleika. I forgot to mention this at the beginning when I introduced Suleika, but we have time for question and answer now. And we can, members in or participants in the remote audience can use the hand like icon, raise your hand essentially, and we can unmute your microphone and you can ask a question directly. Or you can send a question in via chat. So I have one question here that I received, and I'm just going to go ahead and read it. It's from Jonathan Abrams. And Jonathan writes, "Thank you for sharing your valuable experience and insights. Did this earthquake experience improve the post-event emergency preparedness for general health care, especially for those who are most vulnerable, such as the children, disabled, and the poor?"
Yes, after this experience, we really felt that it is very necessary, and we prepared our emergency department team. They prepared a very nice disaster plan, and now we have all of the setups for the disasters, and even we have many road traffic accidents every day, and so we have been preparing and we have been using it very often.
So I have a question for you, just based on one of your last slides. One of the lessons learned was warehouse it for emergency supplies,
Mhm.
emergency medical supplies. Uh, how far away is that from the actual hospital?
Mhm. No, it's actually they prepared in a big room nearby the emergency department. It's not a very big one, but a big room, and they have different trunks, and they have all those materials in this room, and it's nearby.
Okay, so it's in the same physical structure.
Yes, in the same physical structure.
Okay, now I see lots of people asking questions. Um, and by the way, anyone in the remote audience, we can actually unmute your microphone and you can ask a question directly. Or if you prefer, I can read it.
Mhm.
So I'm just going to go down the list here. I have a question from Ola Dunan Bell, and I'm going to take a look at what she has to say. Okay, so Ola writes, thank you for this presentation. I'm wondering about the lessons learned. Were you able to identify your greatest vulnerability, and what explicit changes were you able to make to address this?
Um, yeah, it's I think the most lacking thing we still have is we don't have enough space if the victims are more than 100. We only have the capacity of treating 100 patients at a time. So if the earthquake or other disasters come again, then we will have the same scenario. So for this, we have been talking with the emergency department again and again, but still it's a challenging thing for us because we experienced that there were more than 100 people coming at once, and we had the problem. So still it will be a problem for us, but if they are less than 100, and we will be managing very well. And for now, we will be also contacting other hospitals in Kathmandu so that we could refer them. We could triage here and refer some patients who are not very serious, but we could refer the patient. So we are now on communicating with other hospitals also so that we could treat them mutually.
Okay, I have another question here that's somewhat similar to what you just mentioned, but I'll go ahead and read it anyways. It's from Angelica Underwood, and
Mhm.
Angelica writes, how many patients came the first day, and how did you handle the surge of patients?
Mhm. Yeah, the first day there were more than 100 patients. So you can see on the picture that we had to keep this patient on the mattress and on the floor, and we had to treat there. So for the first day, it was very difficult. And but from the second day, we could open this white building, outpatient building there, and we could shift patient there. And then again, we just could receive more patient on the ground and treat there, and we triage the patient, and they if the patient were very serious, then we took them to the shock room in emergency department, and if they needed the surgery, we could take to the theater immediately. So this was how we managed. And some green zone patient, they were still waiting in the ground, on the ground, and the patient who needed admission, they were taken to the ward. So this was how we managed.
Okay. Um, Again, if anyone wants to ask a question directly, we can unmute your microphone, but I will continue reading the questions that have come in. So the next question I have is from Joanne March, and Joanne says, thank you very much for telling your story. I am taking a medical course, and I'm wondering what mental strategies you used to stay focused when so much was happening around you.
Mhm. Yeah, our main aim was to save lives because we also had family at home, and they were my daughter. She was 12 at the time, and I had to leave her with my parents. And but I was working in the theater, 20 hours a day. And mainly was main thing was when we see the patient and then they needed surgery, then we could not sleep. We have to continue with the surgeons and also the surgeons, and they were also very energetic, and the anesthetics they all were. Everyone was working and moving around. So the main aim was to save lives, and at that environment we could not rest. We were working all the time. Yeah, only a few hours in a day we were sleeping. So the main motivating factor, I think, the people, and then our goal was to save their lives.
Okay, and I have another question here from Candy Kwok. Apologies if I mispronounced your last name. Candy writes, "Thank you for the presentation. Was there any collaboration with other organizations such as NGOs?"
Hmm. Yeah, we our hospital, we have many collaborators since the beginning, because our hospital, it was a concept with the community, but many support were from many countries, from Europe and from also from America. So when this happened, then our friends, they were always asking what is happening and what we need. So we were, contacting them, and many of them, they came with the all those things, that especially for the surgery, because I'm working in theater. So we asked for the implants, and we used what we had in our storage. But when we were running out of this storage, then they brought with all those big suitcases and with the implants and things, and also the dressing materials, and also many other countries like uh, many countries, they came to our hospital. And in our country also, first few days there were, a lot of volunteers coming, and it was very chaotic. But then the government, they made a rules, and they said there that they will be what you call, they were distributing this team in, one team in one place and another in another place. So the government was also doing this distribution. But in our hospital, the many surgeons, they were coming to help our surgeons with the stuff we needed for the surgery, and also for the medications and things. Yeah.
Okay. Um, we apparently have a shy audience, or everyone likes hearing my voice. So I'm going to continue reading the questions I'm receiving. I have a question from William Maynard, and William asks, "Do you do annual disaster training or trainings on a semi-regular basis?" And I think he is referring to the hospital when he says you.
Okay. Yeah, disaster training, it was not done before earthquake. So after earthquake, we learned that it's very necessary. So our emergency team, they have made this plan, and they are doing a lot of drills also. They are doing in emergency and also in the hospital. But in theater, we have not done yet. But as such, they are doing a lot of drills and the practices. Yeah.
Okay. And I think this might be our last question here. So this is from Shinchi Igawa from Japan.
Hmm.
Um, he has two questions. Um, First, he says, "Was the HOPE program to prepare for disasters implemented in your hospital?"
Hmm.
Uh, are you familiar with the program? I'm afraid,
Yes.
unfortunately. Okay.
Yeah, yeah, we are familiar with this program, HOPE program, but it was not before earthquake, because after earthquake I went for this training in Kathmandu, and it is very really helpful. So with this help of this HOPE training, we could prepare the disaster plan, and now we are doing it. So it was not before earthquake, but now we are doing this. We are using this manual, and we are dealing with this.
Okay. And his second question is, was it possible for you to collaborate with other hospitals or international EMTs?
For ENT, with other hospital, we did not do collaboration, because they were also having problems, and many of the hospitals were closed. Only the few university hospitals and army, police, only these were open, but the many private hospitals, they were closed because they could not afford the free services to the patient. And regarding the EMTs, we had a lot of support from different hospitals, like you have seen the field hospital. So it was from the Saudi German hospital from Dubai, and there were also many collaborators who were helping our team with the EMTs also.
Okay, we had a couple more questions just come in. A question from Melissa Kornman, and Melissa asks or says, "Thank you for sharing your story. What was done to treat patients with PTSD and depression,
Yeah.
or I guess mental health issues in general?"
Yeah, yeah. We have also the psychiatry department here. So this patient, after stress, our mental health department, they were very active, and they were doing a lot of classes to these patients, and also they went to the outreach centers for this PTSD. They were doing a lot of work at that also. Yeah.
Okay, well, that looks like the last of the questions. I do have one here from Chris Johnston. Chris is asking, will a recording of the presentation be available soon? And the answer is yes. Sometime today, we'll post the recording of this to Wadham's YouTube channel and have it on the website. So we'll send a link to everybody sometime before the end of the day, or possibly tomorrow. That just depends when I have the opportunity to get to it. But we will definitely be posting a recording of this and letting everyone who registered for the webinar know when it's available. So that's the answer to that question. And I don't have any more questions. We had a bit of a shy audience today. No one wanted to ask questions directly, which is fine. So I think that I suppose we're at a good time to wrap things up. I want to thank you very much for Dhulikhel for taking the time. I know it's evening in Nepal, and that's one of our nursing special interest group chair is waving to Dhulikhel on the webcam.
Yes.
So thank you, everybody. Thank you for supporting the webinar series. We have 2 more webinars scheduled, one at the end of July and one in August. And I'll also provide that information in the email I send out when the recording is available. So if people are interested, they can sign up and participate in those upcoming webinars. And then we're working on the schedule for September, October, November, and we don't typically have one in December, but we're putting together the remaining presentations for the rest of 2018. So thank you, everybody, for participating and listening, and thank you, Dhulikhel, so much for taking time out of your busy schedule to present for us.
Yes, it was my pleasure. Thank you so much. Okay. Yeah, thank you.
Bye-bye.
Bye-bye.